So I think my main highlight from BTOG was some data that came out of 5 district general hospitals, 5 trusts. They weren't all district general hospitals. And Dr. Navani and Dr. Baldwin were leading on these studies. So one of them looked at the diagnostic pathway over time, things like 2-week wait referrals, rapid access entry, number of CT scans performed, this, that, and the other over the last year. And what you see is a sort of certain level of, for example, plain chest x-rays looking for lung cancer. And then the lockdown happened, and you see a complete collapse in those diagnostic pathways. And while we all know that happened, we all know that it was an extreme shock to the system, and a lot of our normal processes effectively ground to a halt very quickly. What was really encouraging, and I think we should take great heart from this, is that you will see that over time it all starts to recover. And what that tells me is what we already know, which is, the staff that work in the NHS are dedicated, they come into work to do good, and they know how to sort problems out, and that's exactly what they're doing. And there weren't, teams of management consultants writing reports here. All of that recovery was down to sheer hard work and goodwill from clinicians, nurses, healthcare professionals, working in hospitals, working in GP practices across the country. And so that's really, really heartening. And it puts us in a great stead for potentially what might be a 3rd or 4th wave coming in the future. So I think we're much more resilient to be able to withstand what's coming in the future. The other thing that the same group presented was stage shift. So what you see is a big drop in the early stage cancers that were diagnosed during this difficult period, and a large increase in stage 4 disease. And that really does marry exactly what clinicians have been seeing in clinic. We've been seeing lots of late presentation, lots of patients with poor performance status, lots of patients with brain metastases, and often quite large brain metastases. And, patients have been getting symptoms and deteriorating at home and presenting very late. And our ability to salvage these patients, to save them, to give them treatments, has been restricted by the fact that many of them have had a very poor performance status when seeing us. So a salutary tale of what can happen when diagnostic pathways get disrupted, but also a lot of hope and something to feel positive about in the data showing that we are recovering and we're becoming resilient.